Our keynote speaker now, who's talking on the session called Window of Opportunity, is a fantastic speaker. Naomi Eisenstadt has very kindly come over to her primary engagement, if you like, for her trip to Australia this time is to come and speak at our Congress. But her availability to speak to a variety of bureaucrats, both at state and federal level, and a number of key ministerial discussions, I think it's been, from our point of view, it's been really helpful to have a leading expert from elsewhere come and speak to this relatively new government that I think the window of opportunity is absolutely correct, because Naomi is really offering some ideas for a government that's got a high level of curiosity because they've only been in the job for 7 or 8 months, and my sense is that there is a real curiosity around what can be done better and what some of the opportunities are in terms of a focus on families, making sure that window of opportunity for children and families is opened from the start, and thinking about how to do that and how governments can do that. We had a very inspiring speech last night from Cindy Blackstock, a First Nations leader from Canada, speaking particularly with a perspective, from a Canadian perspective, of First Nation Aboriginal children and families, and some really strong and passionate effort that is going on within the family caring organisation in Canada around Aboriginal children and families, and I think a lot of her comments were around the underrepresentation of Aboriginal people in education and employment, and the overrepresentation in child protection, justice, and areas that really can only be dealt with by systemic and policy change. It cannot be dealt with by a focus on the individual when it is very clear that systems are failing people. So we very much have got a families focus, I guess, for our Congress today. So Naomi, as the Director of the Social Exclusion Task Force in the UK, she was responsible for the 2008 landmark publication Think Family, Improving the Life Choices of Families. It talked about a system that has no wrong door. And it was talked about how support is tailored to meet needs so that families with the most complex needs receive the most intensive support. Slightly earlier in her career, like immediately prior, Naomi led the rollout of the UK's Sure Start program, which has been a very significant program, which I'm sure she'll be talking to us about, in terms of a very ambitious attempt by government to improve the outcomes of children living in disadvantaged areas, that buys into neighbourhood environments, education, a wide range of different areas. Naomi is now a Senior Research Fellow at Oxford University, and with her key interests are children's services, poverty and its impact on children and family policy. She advocates a progressive universalism approach which ensures maximum support for the most disadvantaged within a universal platform of services for all children, and I expect she'll talk to us a little bit more about that, and she's got some really fantastic concepts and one-liners which I will not quote because she may well be using them. So what we're going to do is hear from Naomi Eisenstadt, and then Michaela Cronin, the CEO of McKillop Family Services and President of VCOSS, will give us a short response, and then we'll have a bit of time for Q&A before an early lunch break. So thank you very much. Welcome.
Right. Thank you very much for that introduction. I have to say, having spent some time with Mary Wooldridge over the last few days and having heard her this morning, I'm not sure why you need me. You know, you are very lucky. I've rarely heard such a thoughtful and detailed minister. She is very, very good. But there are some things, obviously I will comment on some of the things she said, because I think they are important in terms of telling the whole story. And what I'm going to talk about is just how family policy, children's policy, the politics and the policy of change over Britain over the last 12 or 13, 14 years. You can tell from my accent I'm not English. I'm American, and it really helped being American working in England, because I have no class accent, and I'm not frightened of class accents, and I'm allowed to ask stupid questions. And the not asking stupid questions is really, really important, because I'm sure it's the same thing here. In the British civil service, there's a real culture of analysis and intelligence, and everyone is afraid to appear stupid, so they never ask the right questions. And you could see people sort of breathe a sigh of relief when I'd ask something, because nobody understood it. So my logo, when I first became a civil servant for the Sure Start unit, was "There's no such thing as a stupid question." And I think you need to hold that. And I used to model that all the time by asking stupid questions. So what were the key themes over the Blair-Brown years? Reducing child poverty. Mary and I had a quick chat before we started. Tony Blair announced the aim to end child poverty in 1999, and nobody knew he was going to do it. And true, he hadn't spoken to any officials yet. It was a complete surprise. He certainly didn't speak to Gordon Brown about it. And it was an extremely radical thing to say. And I'm going to say a bit about, whether it worked or not. But just the idea of of the Prime Minister announcing that we're going to end child poverty, and just the idea, I don't know what it was like in Australia, but before 1997, our key politicians very rarely talked about children. And when there was a budget, you'd listen in the budget for, are they going to raise tax on booze? Are they going to raise tax on fuel? But we never heard budget statements that had anything to do with children. So things like that, things changed. The discourse changed. And it sounds to me in Australia, maybe your discourse hasn't changed, maybe it's always been there. But a discourse on families and children is itself a huge progressive thing, because it wasn't there before. It felt very, very, very marginalized. Other thing, reducing the gaps in outcomes between poor children and the rest. We know about the social class gradient. I'll say a bit more about that in a minute. Evidence-based policy, which I have to say always makes me smile a bit, because what's the quality of the evidence, and do we really mean it? And actually policy is about politics as well as science. And if you want the voter engagement, as we were talking about before, as Mary was talking about, actually science doesn't do much. It's about what touches your heart. And you can quote statistics and the evidence of people till the cows come home, but if you talk about their children, you're likely to make more progress and get more votes than talking about data. But evidence-based policy is important, supporting parents and supporting parenting, and as Kath just said, progressive universalism, which means that you have to use the universal service base as the way you hang on your specialist services. And I suppose if there's one thing that disappointed me in what Mary just talked about, is that she didn't really talk much about what is the universal base of services for children. We didn't hear much about schools. We didn't hear much about the health service. We didn't hear much about, and if you really want to reach the most disadvantaged, you have to go to where everyone is and make sure you don't miss the people who always tend to fall through the net. For Blair and Brown, the key emphasis was not on the most disadvantaged until a few years later. In the beginning, it was very much on the bottom 20 to 30%. And that isn't the most disadvantaged. The bottom 20 to 30% are basically poor people, and what you're trying to do is shift the curve. And I'll say a bit more about that in a minute. Right, so the key themes of the coalition year. Labour lost the election in 2010. We have a coalition government between the Liberal Democrats and the Tories, and they have a different set of key themes. But as we go along, you see there are some big differences, but some things that aren't so different. So one of the big things that they're interested in, for very good reason, and Labour would have had to do it as well, is deficit reduction. They came to power post a serious recession. We have a very serious deficit, and in some ways, there is a huge push about reducing government spending. And part of that, but Cameron likes to separate it, is this notion of the big society, about what organizations like you guys can do, and how much you use community and community involvement and community engagement, and small state attack on bureaucracy. So big society, small state. And I would argue that actually you can't have the big society without a big state. And I'll say a bit more about that in a minute. New localism. The Brown-Blair years were highly centralist. Lots and lots of targets from Whitehall right down to the neighborhood, incredible detail of what everybody had to do, a real diminution of power at local government level. One of the consequences of taking away power at local government level is that then you tend to get very weak local government, so you can never give the power back. Because who would run for office at local level if you get blamed for everything but have no authority to do anything? So there's a real push on new localism. I always say on the localism agenda, everybody believes in local democracy until it's their issue. But when it comes to their issue, it's tell the buggers what to do. You know, and I'm the same way. I'm highly authoritarian when it comes to things I really care about. But the things I don't care about, yeah, let them decide. And ministers are the same. So the first attack we had on new localism was the Secretary of State, you know, a very senior cabinet position for communities and local government, who said that local authorities would not be allowed to reduce bin collections to once a fortnight. They were allowed to do everything they want on children's services, anything they want on a whole range of other, but bins was the thing that he cared most about. So, you know, it always, you know, the new localism, I never believe it. I never believe it. Supporting parenting, especially the most disadvantaged. They're very, very keen, as I say, about the bottom 2 to 3%. But they're not terribly worried about the top 2%. And I have to say, Labour wasn't worried about the top 2% either. There's a famous quote by Mandelson that was, "We are seriously relaxed about very, very rich people." You know, and it's a very, you know, I mean, it's a very, very important issue because it has everything to do with progressive tax system. And a lot of what we want to do, you can't do without a progressive tax system. What's the biggest difference between the European models and what I call the Anglo-Saxon or Anglophone models, you know, Australia, the UK, the US, and Canada, is that we don't like to pay a lot of tax. And, you know, we get what we deserve. When you don't want to pay a lot of tax, you don't get such great public services. You look at the countries that have very high tax systems in Scandinavia, they get great services. And they are less unequal. And that's a really important issue. Concern about stalled social mobility, which relates to the concern about, you know, the richest as well as the poorest. Stalled social mobility means that if you're born into one social class, it's unlikely that you're going to change social class over your lifetime. And of course, the reason that is because everybody in this room protects the space for our children. Because for some kids to go up, if it's relative, some kids have to go down. And that's all very well, but it's not going to be my kid. So I'm going to tell you, you know, the first of my stories on social mobility, and it's a really important one. I come from frontline practice. I worked for many years with families and children in a low-income estate where I live in Milton Keynes. And in those days, we did stuff on gender. Remember when we were worried about girls' toys and boys' toys and girls' books and boys' books and all that stuff? Okay, so there's a mother of a 4-year-old boy, white working class, lone parent, and we had done this stuff on gender, and she said to me, you know, Naomi, this is really important, because maybe when he grows up, his wife will have a job and he won't, and I don't want him to feel bad. This is a loving parent, not feckless, who at 4 years old is already preparing her child for unemployment. And this is tragic. This is absolutely tragic. And the comparison is, you know, I got to the dizzying heights of being a senior civil servant in the Department for Education, and one of my colleagues was taking his daughter to her interview at Cambridge University. And in the car on the way, he would talk to her about what kind of questions she'd get, because he'd been to Cambridge University. He's a good parent. He's not slipping them, you know, a 5-pound note to take her. He is providing her with everything he has to ensure she has the best life. And that's why we'll never crack social mobility, because we will never crack that difference in social capital between social class groups. Neither of these people are bad parents. But you can see the difference in the life choices that those children will have depending on who their parents are. And my life, you know, has been about trying to reduce those differences. But you know, sadly, I don't think that we've been that successful at it. So we know a lot about poverty and poor outcomes for children. This is the social mobility story, 1970 cohort study. So this is social economic status from the lowest to the highest. So if you're in the lowest socioeconomic status, which is 5, your chances of being multiply deprived at age 30 is 1 in 3. And if you're born to the highest social economic status, your chances of being deprived at age 30 is 1 in 20. But I have to say 1 in 20 is still quite a lot. So you've got some movement, but you can see the difference in the odds on outcomes depending on who your parents are at the time of your birth. And the biggest determinant is mother's education. So it's not the actual income, it's mother's educational status at birth, which is the biggest determinant, at least in Britain, of child outcomes throughout your life. And that determines health in infancy, it determines a healthy pregnancy, it determines diet, it determines virtually everything. You know, is mother's education at time of birth. So children from families facing multiple disadvantages are at greater risk. Surprise, surprise. Did we know that? And how much should, you know, this is where I have some sympathy for Mary. How much should we pay academics to tell us that? I have to, it always makes me smile. You know, 30 years ago, there was a big study on depression, and they found out that if you're a lone parent with 3 under 5s living in a high-rise building with no friends, you were likely to be depressed. Gee whiz. And it was a male doctor, of course, who told us that. You know, clinically depressed. Because if you say clinically depressed, it counts more. Clinically depressed, you know. Gee, thanks a lot. And the trouble is, that's what I mean about the evidence, because some of it is so absolutely evident that it's irritating that you have to pay academics a lot of money to prove it, but you do. You know, that's evidence-based policy telling us what, and, you know, the surprise is when they tell us things we don't want to know. That's what's, and I'll say a bit more about that in a minute. But anyway, so here we go. The one I really want you to look at, and it's very important for this audience, and I'm going to be rude to the audience, I'm afraid, I always am. Look at the fourth one along, which is in trouble with the police last year. Now, if I was in a community sector organization and I wanted to get money out of Mary, or out of Wendy, or out of any of them, I would say, do you realize that kids who grow up in multiply deprived families are 10 times more likely to be in trouble with the police? Give us the money, we'll fix it. And that kids who aren't in multiply deprived families they're only 1%. Now, the important thing is that 10 times more likely, but look at the numbers. It's actually 10%, which means 90% are not in trouble with the police. It's 1% versus 10%. But when you say 10 times more likely, it sounds like they're all in trouble with the police. And that's how we get the money. That's what we've always done, is the way in which we tell the story will make the... But the trouble with doing it that way, and this is the important point, and you know, I mean, the really serious point is we diss the poor. You know, you spend all your time getting the money by convincing whoever has the money how pathetic these families are. And then you have to turn around and work with them respectfully and with dignity. And I think that switch is quite difficult. And I think we have to be careful how we use the data, because it does spread. You know, if you look at all the disadvantages, none of them are even close to 50% of the kids affected. Not even close to half. And it's very, very important that we're careful about how respectful we are to the families that we want to work with, and who basically, those families are our customers. And we should treat them. I always say, you know, that, you know, when I'm in this business, I want to be treated the way I'm treated when I go into Marks and Spencer's. It's somebody's job on the line if I'm not happy, if I'm not satisfied, if I'm not treated with respect. But we have a real problem in the public sector and in the community sector about switching from the arguments to get the money to how do you treat people with respect and with dignity and value what they have to offer. So prevalence of multi-disadvantage, well, this is England data, and you can see that 55% of families have 1 or no disadvantages, 45% of families have 2 or more, and luckily, this is what I mean about the bottom 2 or 3%, as you move along with the number of disadvantages, it's fewer and fewer. And this is about addressing the tail as opposed to shifting the curve. Because if you're interested in the most disadvantaged, you're interested in that bottom 2 to 3% tail. And normally, the things that we do to shift the curve are aimed at the 30%, miss the most disadvantaged, but they're still worth doing because shifting the curve is worth doing. It does make life better for those 30%, and it does sort of create a new environment. But it is a sort of tactical decision which you do. The question I asked when I was presented with this data is, so the one disadvantage in the 55% group, what is it? It's most often alcohol. And alcoholism is cross-class. And again, it's a really important issue because there are particular disadvantages like alcoholism, like child sexual abuse, which are cross-class. And as much as we diss the poor by assuming that they have all these disadvantages when most of them don't, we also miss a lot of unmet need by assuming the not poor are fine. So we miss a lot of need by making assumptions about the relativity of disadvantage, which is really important. So there's ongoing debates about the role of government, and I divide up the role of government into two key areas. So governments reduce pressures on families, but they also enhance capabilities. And of course, they intervene to safeguard children. So reducing pressures, basically, as far as I'm concerned, is about cash. And whenever we talk about poverty or poor kids, we don't talk about money. I'm American, I talk about money. Do I want a parenting class or do I want 10 pounds? Actually, I'll have the 10 pounds, thank you very much. Because then I get to decide what to do with it, not you. And the trouble is that the current government is very keen on the skills training, improving the capabilities. They believe that if we just make people better parents, that will solve the problems for the next generation. And they're not really tuned in enough to the things that you can do to make it easier to be a better parent. And I'm not saying that you don't do both. I think both are really, really important. And we have really good data. I know what good parents do. I just don't know how to make people do it. And if telling them worked, we'd be there, wouldn't we? You know, I want every mother to read to her baby. But telling a mother to read to her baby doesn't really work. It's about the environment in which you're helping people, you know, reducing the pressures as well as enhancing capabilities. And one of the classic ones I always say is, you know, if you held the parenting class in a free laundrette, I'd be there. If I can do my washing at the same time. And that's, you know, because a lot of the officials, a lot of the public servants who are making these policies have never understood that some people don't have a washing machine or can't afford to run the washing machine. It's that basic about understanding how poor people live. And I'm not on the sort of the community development side which says, oh, they always know best, and if you just, you know, give them the money, leave them alone. But I'm not there either. I'm very much about a both and, not an either or approach. So what did Blair and Brown do? Well, they did Sure Start, which was great for me. Gave me the best job in the world. But the other thing they did was a much wider policy agenda called Every Child Matters. Now, both of these, Sure Start was about under fours in poor areas, in, you know, very much an area-based initiative, but once the area was chosen for all the children in the area, bringing services together, and again, trying to do that both and of reducing pressures and enhancing capabilities. Every Child Matters was kind of Sure Start grown up. So instead of being about under fours, it was about 0 to 19. It was about absolutely all children, and it was an outcomes framework about what we want for all children and the recognition that you need different approaches for different families, but we want the same outcomes for all children. And it's and this is what I mean about progressive universalism, an outcome framework that says this is right for all our children. And what are they? Being healthy, staying safe, enjoying and achieving economic well-being, making a positive contribution. Not a bad list. And in some sense, the list doesn't matter. It's about getting every single agency that has anything to do with children to sign up to it, to say this is what we want for all children. And it was about a unifying force, a unifying culture around breaking down the silos, bringing the silos together, saying everyone has a contribution to make for all children. And some of the key features in it was creating at local government level, instead of having a director of education and a director of what you would call human services, we call social services, having one director of children's services. So a director responsible for those 5 outcomes for all children in that jurisdiction, 0 to 19. An amazing achievement. Now, the thing that I was most excited about was that we renamed the Department of Education the Department of Children, Schools, and Families. And within 24 hours of the new government, they went back to the Department for Education. And it really was heartbreaking because we fought so hard to have a department for children. And of course, they said, oh, it doesn't make any difference, but the signals were really important. And the other thing that's really interesting is that the Every Child Matters framework has basically disappeared, but they seem to be committed to keeping Sure Start. And I'll say a bit more about that in a minute, but I think it's really interesting that. So did Sure Start work? Well, the answer is yes and no. But the important thing about the no is that we learned a huge amount and changed it as we went along because we were finding out what wasn't working. And that you can look at the slide, but the short story, and this is about the curve and the tail, this is why it's so important, it worked for poor families, it didn't work for the poorest families. And what happened, and again, you will recognize this, and I don't mean to rude, I've been there myself. The reason it works for the poor and not the poorest is that when you're working in local communities, the sort of pretty competent come forward first. And they love you, and they eat your time. And you feel great because you're incredibly busy and exhausted at the end of the day, and you've got people coming to your centers and using your services that are very grateful and very compliant and really, really positive. And then the minister comes and visits, and all these women say, this changed my life, it's the best thing that ever happened to me. But you don't know who's not coming. And as long as you get that huge reinforcement, that positive reinforcement about who loves your service, and it eats all your time, why would you try to find out who's not coming? And that's why you miss the tail, but shift the curve. Because you get the curve, and it is a good thing to do, and it is a really good thing for the, you shouldn't assume just because they come, it doesn't mean they don't need the services. It's the, wants and needs versus, needs but doesn't want. And your problem is the time, the energy, the effort to get the needs but doesn't want. And it's a marketing issue. It's a, they're not coming, why not? Not they're stupid or non-compliant or smelly, how do you do the market segmentation? If John Lewis wants me to come to John Lewis instead of Marks and Spencer's, it's John Lewis's problem. It's not my problem. They have to figure out what I want. They don't write me a nasty letter. They don't complain that I'm a do not attend. They don't make me feel bad. They know that unless they make me happy, I'm nowhere. And that's the attitude we have to take towards the tail, is much closer market segmentation. And it costs more money. It costs more time. It's more difficult. So just in terms of the final results, by 2007, we'd solved the problem of the poor and the poorest because it all came together. We got very, very good results. The interesting results in 2011, which of course is hot off the wire, is that we got really, really good adult results and some child results in terms of health, but no difference in terms of cognitive gains. And the reason we think we've got no difference in terms of cognitive gains, honest gov, it's not an excuse, is that by 2011, all children were accessing the universal 15 hours a week free early education offer. So there wasn't a big cognitive difference between the Sure Start children and non-Sure Start children because it was a universal service, all children were getting it. And that's success. That's really good news. That's really good news. So overall achievements from 1997 to allow me to indulge myself because I'm really proud. I think we did incredibly well. Maternity leave, 12 months, paid leave for 9 months. When Blair came to power, maternity leave, paid leave was 18 weeks, so we went from 18 weeks to 9 months, and the new government wants to extend it further. So huge, I mean, I was having my hair done, and my hairdresser was pregnant, and I said, well, how much time are you taking off? And she said, it's fantastic, they've changed it to 9 months. And I just sat there so proud. Yes. Yes, good news. And when she came back, she'd been using the Sure Start Children's Center. It gets better and better. It gets better and better. How wonderful it was, and I've got stay and play, just fantastic. Right to request flexible working. This is free. This doesn't cost anything. There was big concern that private companies wouldn't like it. In the first 2 years, 25% of parents asked for flexible working. 80% were given what they asked for. Now, the really interesting thing about the flexible working is that employers really liked it because it builds connection to the employee. You're less likely to leave. It builds loyalty if you've got your childcare arrangements, because the risk of leaving is the new employer may not be so helpful about you. So it really did very, very good things. No one's complained about it. It's been extraordinarily successful, cost nothing, and very, very good for kids, very, very good for parents. We did reduce child poverty. We reduced absolute child poverty by a half, but relative child poverty by only 15%. And the reason that the relative is so poor and absolute is so good was what I said about the top 2%. Relative poverty is based on the median income, which is halfway between the richest and the poorest. So as the richest get richer and richer and richer, your median keeps moving. So you're chasing a moving tail. I mean, the Americans thought we were crazy to have a relative poverty measure, because it's so impossible. But a relative poverty measure, actually in terms of outcomes for kids, is really, really important within country. It's really, really important. We now have a children's center in every community. There's 3,500 of them. There are some cuts to them, but basically the infrastructure is there. All children accessing universal, free, early education, 15 hours a week for all 3- and 4-year-olds, and an expansion for 2-year-olds. And legislation passed making the provision of children's centers a statutory duty, and legislation passed making every area have a strategy for reducing child poverty. And we're getting some results. The gap is narrowing. We have an early years foundation stage, which is the assessment of children at age 5. It's steadily going up, but the poor kids are going up faster. So we are narrowing the gap, right? So we need to go. The current government vision is not far off, and that's really good news. This was published a couple of weeks ago, and they're seeing a whole zero-to-school strategy, an integrated strategy with health, education, social welfare, and they're sticking. And I think this is, the most amazing achievement, but there's dangers ahead. There's an emphasis in the new regime on parenting, but not on reducing pressures on families. So that I'm really worried about. There's a likelihood of rising unemployment because of the service cuts, and because the service cuts are mainly in public sector, it will largely impact on women, which means it will largely impact on children. There's reductions in tax credits, reduction in housing benefits, and increased conditionality like you're doing here, and an overall benefit cap, which will be particularly hard on large families. So what I'm worried about is not the service infrastructure. I'm worried about more poor children and greater demands. So the new political environment, and what have we learned? Well, one of the things we learned is that community development is essential for engagement, but not enough to shift outcomes. And this is where that business about how do you get them in, but once they're in, you don't just do aromatherapy. You do the parenting programs. And it is, we like to do the things that families ask for, but, often the things, I have never been on a low-income estate and, seen an 18-year-old teen mother pushing a pram who says to me, what would change my life is triple P. This isn't what people in disadvantaged areas ask for, but it may do them some good if you can do the negotiation between what they ask for, the free washing, and what will do their kids some good. Our biggest problem has been the need for reliable data, understanding baselines. The only way you know who isn't coming is by having data on where the babies are and being able to visit them, doing the outreach. And, of course, one of the worries in terms of cutting all the public service stuff, we hate bureaucrats, don't we? But it's the bureaucrats who have the data. And the bureaucrats do the counting, and we'll be in real trouble without them. I say that as a former bureaucrat, just protecting my old industry. Challenges of working across agencies, it's really hard. The cultures are very different. The way in which agencies work is very different. The confidentiality agreements is very different. It's just a real struggle. And I was really, really pleased to hear Mary talk about so much about workforce, because Our biggest mistake was not paying enough attention to workforce. We didn't recognize how hard it would be to run a Sure Start program, and we didn't properly prepare people to do it. And we rolled out the program really fast at the cost of helping people understand the task that they were doing. So I think that was our biggest failure. The fact that you're really thinking about that here, you know, good news. And the other thing about workforce is that, you know, the other good thing about your politicians talking about it is that for the general public, they want more of something, not usually better of something. And when you say you're going to make it better, they say, well, why wasn't it good before? So it's a political risk, and therefore a brave thing to do in the best sense, you know. So I think the workforce issues are really good. New enthusiasm for payment by results really worries me. They want to give sort of extra money if you can demonstrate that you've made a difference, which is completely sensible in things like reoffending rates in prison. You know, if you can prove that when you look after offenders when they come out of jail, they don't go back into jail, you can do that in 2 years and you know who's in jail. So it's an easy measure. It doesn't take a lot of bureaucracy to count. But early years, when do you know? 2 years, 5 years, 10 years? What's your measure? How do you do payment by results in early years? So that really worries me. And this is the legacy. We've done a lot. We have a lot to be proud of, but you know, it's never finished. And you know, there's a lot to learn and reflect on. And I'm going to end, I know I'm finished, but I need to end on one more story just because it's my favorite. All right, well, okay, so I've got more time. It's my favorite story, and it really isn't about what we're talking about, but it's a good story. It's about children. Well, actually, it's about the silos, but different kinds of silos. You know, when Mary was talking about indigenous people and disadvantaged and all that stuff, in Britain we use the word diversity. And we use the word diversity, that's a sort of code word usually for race or poverty or whatever. And of course, race in Britain is very complicated because, like in Australia, we have very complicated different groups of immigrants who, you know, I mean, you lump them all together and you forget that the Indians in Britain do much better than the white kids. You know, so it's really important not to think race disadvantage, because some of them actually do really well. So when we talk about it, it's that code word about race. And I think diversity is much more complicated. And the story I'll give is from my family. I promise this is the last story, but it's a good one. God, now it must be 25 years ago, my sister got divorced, and a couple of years after she got divorced, it turned out that her first husband was gay. And they had 2 young children. And my niece Lisa was then about 8 or 9. And of course, my parents and all the adults were really, really anxious about what impact it would have on Lisa having a gay dad. So you know, being the kind of child-centered person I am, I didn't sort of whisper in the corner. I went to Lisa, and I didn't say, how do you feel about having a father who's a homosexual? I said, Lisa, how do you like Ken? Ken was her father's boyfriend. And Lisa said to me with a very serious face, she said, Ken's very nice, but he's not Jewish. Right, okay, so it gets better. I tell the story everywhere. So last year I was doing a lecture tour in New Zealand, and I was speaking to a Maori group, and a really nice next to me, and I wasn't sure about the sensitivities on gay and lesbian politics in New Zealand or on Maoris. So I asked this really nice woman, can I tell a story about gays and lesbians? She said, of course. So I told the story, and it was fine. And she was incredibly warm and nice, and she invited me to her house for dinner that night. And of course, I go to her house for dinner, and she introduced me to her female partner. So I had done exactly what I say everyone shouldn't do. I put her in the Maori box, not in the lesbian box. And that's why diversity is very complicated. Thank you very much.
Thank you. What we'll do is we'll get Michaela Cronin to come and do a short response. And because we're running a little bit early this morning, that means there's a bit of time for a bit of Q&A and the opportunity for a couple more stories. So, Michaela, if you'd like to come and give a response to this presentation. Thank you.
I would very much like to. I think we've had an absolute feast this morning, and I'm actually not going to talk for very long because I want you to ask more questions of Naomi. Because what we've heard this morning is the Minister talking about having an appetite for change, what the government is doing around, and there's a lot going on in that space. She talked about the inquiry, she talked about what's going on with COAG, She talked about some interesting things that are changes that are happening, that some of which, I mean, one of them I hadn't heard about, but it sounds pretty significant, around changes at a local level, changing the way government's working so that it's less siloed. So we've heard a lot about that there is a capacity and change happening at the moment, and we've heard a lot from Naomi about some of the changes that she and the government were able to effect. And what I've been very curious, having had a bit of an opportunity to talk to Naomi about, is how do you do that? How do you achieve those changes? How do you make that difference? Because some of what Cindy talked about at dinner last night was her frustration about how, and Naomi talked about this morning too, we know what needs to happen. We don't need a whole lot more studies. We know what things are going wrong, and we know quite a bit about what needs to be done to change it. Where we get stuck is, how do we implement those changes? How do we get government to make the changes that we know, and a lot of them know, a lot of bureaucrats know need to happen? How do we actually make those things different? And I really want you to ask Naomi some questions, because she's got some really good ideas about that, and was able to achieve quite a bit of change. Mind you, one of the things she said the other day was that she had access to a $1 billion chequebook. So the aspect of money definitely helps, and having a government that is committed to actually opening its purses up to that. But just a couple of themes that I actually want to identify in terms of some of the stuff that Naomi has talked about today, and we really have, Kath said we worked her at the start, and we really have worked her. Naomi's been here for about a week, and during that time has spoken to the other day, a group of 10 ministers. She's spoken to Mary and Wendy. She's been to Canberra. She's had engagements all day long, and that's incredibly lucky for us that has been so well organised by VCOSS and the staff, because there is an opportunity, and they are listening. They are listening, and they do want to hear about ideas for change. Some of the things that Mary and Naomi and Cindy talked about last night was collaboration. And the need for collaboration across government and with us and all of the agencies and organisations that we work for. Ensuring that systems see children. A lot of our systems don't see children, don't ask questions. One of the things Naomi said the other day when we were talking about was drug and alcohol service, where nobody asks, do you have a child? And nobody asks because they don't. And some of it is around workforce issues, some of it is around they are afraid if the answer is yes, what will I do with that information? There's been a lot of talk about respect for families. One of the things I heard, again, because I've been lucky to spend a bit of time, Naomi said the other day was, and it's paraphrasing what she's talked about quite a bit this morning, go to where families are but don't leave them there. And that's really stuck with me, that you actually need to engage and listen and go to where they are, but you don't leave them there. So it's the both and story. And the progressive universalism that she's talked quite a bit about, that you need the universal platform that actually has the capacity to pick up everybody, but that's not enough. You need more than that. You need to be doing both and. I mean, I think that, as I said before, we have been very lucky, and that today is very much around, and the sessions that are going to be happening this afternoon are about listening to some people who have some very innovative ideas about change and what it is that we are able to do as a sector together. But I think that what is absolutely crucial to take away from today is that we have a window at the moment. We've got an opportunity to affect some significant change, and we have a responsibility to do that together and take that challenge up. So please ask Naomi questions about how she was able to achieve some pretty significant changes. So we've got quite a bit of time. We've got 20 minutes, so we've got time for questions. So, Dean, so does this mean I get to make Dean run around like he did before? Yeah. Okay, so the first person who put their hand up.
I wonder if you would tell us a story about the work that you've been doing with children's services and how that has worked with the health services in Britain. In particular, I'm interested in primary care trusts.
Oh. Right. Fortuitous. I served on the board of my primary care trust locally until a couple of weeks ago. And I've been on the primary care trust board for about 10 years. It's very interesting about culture and how I was the children's champion on the PCT board. And primary care, they don't see children as children. You know, they see patients and they see illness. And it was very, very hard to get a sort of lineup in preventative strategies. So what would preventative strategies look like? Putting midwives and health workers right into the children's centers so that they could get the service there. I mean, I can give a really interesting example in terms of the culture gap in terms of health and children. And this goes to the heart of child protection. We have a requirement for anyone who works in the National Health Service has to have child protection training, whether their primary contact is with children or not, which is quite right. And so when I had my induction as a non-executive director on our primary care trust, we had a full, probably hour and a half on patient confidentiality. And on, if you get it from your computer, you have to lock it, and all the passwords and all that. In induction, we had nothing on child protection. Now, what that means is that the real emphasis as someone enters, you know, working for the National Health Service, is on what you don't tell, what you're legally required to tell. And that culture of don't tell is very, very powerful in the National Health Service, and I think prevents a lot of the best services reaching, in health terms, the right people, because health won't tell anyone else. And we found the same thing in Sure Start, that the Sure Starts that got the best results for children were health-led because they had the data. But the Sure Starts that weren't health-led, it was very, very hard to get the data out of the health service. And the one I always say is that the NHS treats your name and address the same as your HIV status. They don't distinguish between level. Anything is a secret. So it's a real struggle. And the governance of health and the governance of all the other systems are different, but it's getting better, and there's always huge renewed efforts to get it better. And what I'm really pleased about in that slide I showed about the new service framework is how much is on under twos. And if you're really working on under twos, then you're really going to engage health, because that's where they are.
Where's the mic? So down here and then over there.
Hi, Rosemary Barker from the Office of the Public Advocate. I wanted to ask you about that issue about the market segmentation, because I think that's really one of the crucial things. And I suppose I'm interested to know whether or not you've got any stories to tell us about how you actually got to those people who didn't come to the services. Because, as you say, they are the people who are the hardest to actually support and help. And to give them some vision about opportunity, because I think part of it is, they don't see that opportunity, and how can we actually get there to do that for those people?
So I have a great story, but poor Kath has heard it now 3 or 4 times. In fact, Kath could tell it herself. One of our most marginalised groups in Britain is gypsies and travellers, who stay away from public service. Their kids go to school, but they have a very high absentee rate, and they tend to leave school around 13, 14. Their educational attainment is very, very low. And most GPs don't want to register them because they move around. So in terms of the universal platform, they tend to not engage as much as we would want them to in the universal platform, which leads to poor outcomes for their children. So what happened with Sure Start, and this was about having the money, but it's also about having the skill. We had a local program manager in an area of England called Telford that already had a very, very good traveller site. A traveller site is where you park the caravans, and there's hot and cold running water. This one actually had washing machines. So it was, again, the free washing machines. Yeah, but again, it was and of course, it had nothing to do with children's services. The traveller site was maintained by environmental services from the local authority. Just happened to be a very good site. So the program manager goes onto the traveller site and asks the women, what do you want? The traveller site is miles from anywhere else, because most people don't like to live near gypsies because they think they're going to steal stuff, which of course is a myth. But anyway, so you don't please the voters locally by putting a gypsy site near. You know, you please them by putting it as far away as possible, hopefully in another, you know, in another county. So anyway, so he goes onto the traveler site and they say, well, we're far away from everywhere. There's nothing for the kids to do. We want a playground for the children. So he went away, brought back the catalogs, left the catalogs with the women, went away, came back. They said, we'd like this and this and this. They said, well, actually, that might be expensive to maintain. But the end of the story is, in 3 months, we built this play park at the back of a traveler site. It was the first dedicated play park in a traveler site in Europe. I mean, maybe in the world, who knows, but we heard it was the first in Europe. When we opened it, and this is the thing about, you know, I had the best job in the world, I got to cut the ribbon, and they're all thanking me and telling me how wonderful I am. I didn't do anything. I wrote the check. You know, I had the biggest checkbook in the world. I wrote the check. Everybody's saying to me how, you know, how terrific. But a couple of things were really important about the opening. One of them was, for the local authority, the Director of Education and the Director of Social Services turned up at the opening. So, which again makes this very marginalized group feel like they matter. First time that, you know, they would have had contact with that level of official in local government where their relationships would have been rather tense. So this was fantastic. And it all went, and one of the women, this is really moving, one of the women said to me, this is the first time we've ever been treated like ordinary human beings. And I said, well, what do you mean? And she said, well, when I go to sign up at the video shop, remember video shops, renting videos, it's always full. They won't, you know, so there were all these places where they were wanting to engage where, you know, it was no gypsies. So this is the first time something was done particularly for them. But the most important part of the story in terms of the both and is that then the program manager laid on transport to take the kids to the local early education center. And it was that, and there is no way those kids would have got on that bus if we hadn't done what the community asked for first. So we started where they were at, but we didn't leave them there. You know? And of course, once you get that engagement with the early education system, everything else flows from that. You've got them in the system. You know? And you're on your way. Sorry, it was a long answer.
It's a great story.
Andrew Phillips from Uniting Care. What services would you advocate for 1 and 2 year olds particularly? So that bit in the middle between maternity leave and that just after birth health services and getting into early childhood services at 3 and 4.
The key ones really that most of the Sure Start Children's Centres do is something called stay and play, which basically is drop-in. But then it's a question of how you use that time with mainly mothers, but sometimes fathers, in terms of parenting advice, health advice, you know, toddler tantrums, all that kind of stuff. But the really big one between 1 and 2 is language and reading. You know, read to your baby. A lot of people don't realize you should be reading to a baby at 1. And language is really, really important. Talk to your baby, read to your baby, sing to your baby. So there's this program in Britain called PEEPS, which is really about women sitting around on the floor with their babies singing nursery rhymes. But that kind of, and some people are very, very just embarrassed about doing it. Actually, I won't say who, but you know, it happened to me in Australia, and one of the, not Victoria, but a minister from another state government said to me, it's kind of counterintuitive that you have to talk to your baby before they can speak. Great, exactly. Yeah, this is really encouraging. You know, so how do you think they're going to learn to speak? You know, so the most important thing is encouraging that stimulation, encouraging the talking, encouraging the reading, encouraging the singing, encouraging the playing. You know, and the other thing that's really important is that just because you got the job, it doesn't mean you don't have to read to your baby. So there is this big split between the parent support for the unemployed, and then we kind of forget that parent support for people who have jobs. So do you run anything on a Saturday? Do you run anything in the evenings? If you run it on a Saturday, do you provide food, you know, like it's really important. So it's always about reducing the barriers, reducing, you know, the stresses, but getting the key messages across.
We've probably only got time for one more question. That was a very eager hand, but down here.
My name is Melba Marginson of Victorian Immigrant and Refugee Women's Coalition. And we have a fantastic program, and you're talking of windows of opportunity. We have a fantastic program called Women Building Bridges, and we're starting it now. And it's about empowering women at the community level to become the champions of good policies. And especially because we work with immigrant refugee women, we want immigrant refugee women at the center of this, but working with mainstream women so that together, you know, they can produce better outcomes. So I'd like to probably ask you for more stories. I mean, in terms of how you have worked with migrant and refugees in Great Britain to get them to actually support and get into the program.
Well, I'll tell you the great story where we got it incredibly wrong. I mean, it's always the things that you learn about your mistakes. I used to work for Save the Children Fund, which was a great organization, and we did a lot of work in London with new arrival Bangladeshi women. And there were two things we got significantly wrong. So we had a center, which actually is still running right near Euston Station, for explicitly just for Bangladeshi women, because we knew that the men wouldn't let them come if there were men around. You know, so we were culturally sensitive enough to do that. But we spent a lot of money translating all the materials and all the health advice and all that and the leaflets into Bengali when the women were illiterate in their own language. So that was the first mistake, not realizing that they couldn't read in their own language, so we did the leaflets. But the other thing that we did is that we wanted this to be an employment program so that they could get out and so get jobs and be less poor and all that. And we offered them childcare training, and they wanted computer training. So, you know, I mean, I just think that lesson about listening to what they want is really, really important. But again, sort of pushing the boundaries. So it's just so easy to get it wrong. That, you know, that's my, you know, my lesson is I remember most from when I get it wrong.
Okay, thank you, Naomi.
Done?
I think we need to wind up. Please join me in thanking Naomi.